I'm trained in internal medicine and in pulmonary and critical care, which means that I treat diseases of various organ systems, but more specifically, I focus on diseases of the lungs. In the intensive care unit, we deal quite frequently with patients who are really sick and who are dying. And it's really important to us to make sure that the care we provide to the patients is consistent with their own values and their own sense of dignity. What we have at Loyola is a dedicated clinic called the Advanced Directive Clinic, where patients can come and meet with me and perhaps bring their family members to have a discussion about what's important to them. As part of this meeting, we're able to sit down. I'm able to document in a note things that are important to them, their values, their priorities, and their preferences. And that way there's a written record of the things that are important to them. For patients who are interested in coming to this clinic, they can either be referred by their primary doctor or by some other specialist, or they don't need to be referred at all. They can merely call the Patient Access Center and make an appointment with the Advanced Directive Clinic, and we can help them arrange those appointments in that way. The other half of the work that I do is related to clinical ethics. Most of the time in the care of patients in the hospital, the right kinds of treatments for any given patient are pretty clear. And the doctors and the nurses and the other healthcare providers will have that conversation with the patient or their family, and then there's a good shared decision-making process to make sure the right treatments are chosen. In a small number of cases, making sure that the right treatment for the patient is chosen can be much more difficult. Oftentimes, there can be some conflict or disagreement between a patient and the family, or between a family and the clinical team on what the best course of action is. And that's a great opportunity for an ethics consult or the ethics committee to be involved to help patients and families and help the providers navigate some of these very tricky issues when they're confronting healthcare decisions. It's important to me that by listening to patients and their families, that we can deliver care that not just is in the best interest of the patient, but also can help families adjust to the illness of their loved one and what the eventual outcome might be.